Hello, everyone, and welcome back to this European AI Week, especially the health track that is ongoing on this Wednesday, March 29. In this event, after the opening keynote and after a specific event on all questions asked on mental health, we will be presenting the Barometer of Adoption of Artificial Intelligence in General Practice. This is a Belgian national survey. It is the first initiative of the kind that is measuring the physician's perspective on artificial intelligence in general practice, taking into account the whole base of medical doctors in general practice in Belgium. And we will be presenting the results for the first time today. So, of course, artificial intelligence has been a way to improve healthcare, as we have already said during the opening session today. Artificial intelligence has taken a considerable place in the healthcare sector, as it has a strong way of improving the way we treat for patients, improving the way physicians work, and sustaining healthcare organizations. In 2021, we published the first national barometer on artificial intelligence in hospitals that had quite a strong impact on the policymaking that came afterwards, especially in the case of the convergence plan for artificial intelligence in Belgium. But what we didn't do yet is measure the interest and the adoption of artificial intelligence in general practice. And so what we did is we replicated the effort of the Barometer of Artificial Intelligence in hospitals that we made in 2021 and adopted the questionnaire for general practice in 2022. We conducted the study thanks to the strong support of Medi-Sfeer, which is the journal specialized for medical doctors in general practice in Belgium. The counterpart is the doctors, specialist doctors for the journal. And of course, in partnership with AI for Belgium, if not, this would not be here today as an event showcasing how AI for Belgium has federated the AI approach in healthcare with the AI for Health workgroup. And the research part of this study was conducted within the chair of Artificial Intelligence and Digital Medicine that I have the pleasure to hold at the University of Mons. So we recruited general practitioners all over Belgium to answer to our study, and we had more than 2,000 respondents to our questionnaire. We had of the participants in the study, more than 95% that have heard of artificial intelligence in clinical practice. So what we had is a strong interest in the topic, as more than 80% of the participants were interested in artificial intelligence. The strong interest can be justified with the strong mediatic exposure, but also the impact that it is having in the healthcare sector. 60% of our participants came from the Flemish-speaking part of Belgium, whether more than 30% came from the French-speaking part of Belgium. So in Dutch speakers, we found that Dutch speakers, yes, they had a more marked interest in AI than French speakers. The difference was significant, with no difference in relation to the work environment or the impact of the age. In specific, the affinity for new technology was a strong driver for the impact in interest on artificial intelligence. So after having looked at our sample, let us take a look at the how general practitioners in Belgium view artificial intelligence. So these results are shown in median. Participant had the choice to answer from 0 to 100. What do they think of artificial intelligence? About the positive view, we had 58%. impact of AI in the next 5 years, 50%, importance of AI for participants, 50%, and positive impact for AI and general medicine in practice, 50%. Okay, so what we can see in this first results is that when doctors are pushed into telling whatever they think about artificial intelligence, even if there is a strong interest, what we see is that doctors are quite mitigated when it comes to actually determining the impact of artificial intelligence. This is normal, as there aren't so many educational opportunities out there. We only started giving out educational opportunities for general practitioners. We did the questionnaire before mainstream educational opportunities, such as the Certificate of AI in Medicine, was available in Belgium. So looking at the benefits of artificial intelligence, this belongs to the participants of the study that agreed with the proposed benefit. So 76.6% of participants agree with the increased speed and reliability of decision making. So AI as a drive for improving the way we do decisions and improve the way these decisions are reliable in clinical practice. The same cipher for reducing the risk of error. So as we see, the quality-related items in this questionnaire, as for the case with the Barometer in 2021, is again a strong predictor of how medical doctors relate to artificial intelligence. So quality in the healthcare is a hot topic for general practitioners, especially in the field of AI. 63% allow a more personalized and more adapted follow-up of the patient. This is particularly the case with artificial intelligence, as we can have more personalized way of approaching the way we treat patients. Reducing the risk of accidents and occupational diseases is another benefit that is expected of artificial intelligence, as well as improving the quality and health at work. So this is a particularly important item, as we saw, it is one of the drivers for artificial intelligence in healthcare to support healthcare practitioners and reduce the rates of burnout, reduce the rates of having diseases at work, and to facilitate the life at work for healthcare practitioners. So we then asked general practitioners to answer the question, where will AI grow the most? So 88.6% support in the analysis and the interpretation of examination results. So this is not news. This was already the case with specialist doctors in the first Barometer. This is strongly due to a great need in the fact of having tools for interpreting results and answer the patient quickly. The second, similarly supported rate was the development of preventive and diagnostic actions. So, of course, general practitioners, family medicine is deeply interested into improving the way we can do preventive care, and this is shown with this second item. Remote follow-up and monitoring of patients, as we see, 76.2% are interested into following patients at home. So this contradicts directly what many people think, that medical doctors should not burden themselves with remote monitoring. This barometer shows exactly the opposite. The identification of the most suitable treatment, the same percentage of people is interested into personalized treatment selection, as well as the implementation of intelligence platforms for patients. So these were the 5 more important effects denoted in the study. So, of course, after the benefits and after having determined what we expect of artificial intelligence, let us study the risks that artificial intelligence, how it is perceived in general practice. As we can immediately see, compared to the benefits, the percentage of agreement with regards to the risk is much lower. What are the risks that we questioned our participants about? Loss of social ties, dehumanization at work, appearance of new psychosocial risks. These two, in a very interesting way, were the two same risks identified by specialist doctors in the first barometer that we conducted in 2021. So this shows that the fact of being worried about the loss of social ties and the appearance of new psychosocial risk is a stable worry that medical doctors have. And of course, this should be countered with appropriate measures. Decrease in interest in the work carried out, impairment reliability, deterioration in the level of employment, appearance of the new accidents at work, occupational diseases. So these are results that are, of course, less shared in the medical community. I take 1 minute to specify that these results will be available in the next issue of the Numeric Care journal in less than a week. So stay tuned for the full results. So we then asked the doctors to think about the organizational and societal risks and impact of artificial intelligence. So a strong 80% about the rethinking of the organization of work and distribution of tasks. This is extremely funny because at the same time of this event, we are building another event on the skills of and work at the age of digital and innovation. So rethinking how tasks are redistributed and how work is organized is, of course, a main priority. This is even more so the case after the advent of large language models such as ChatGPT. The second priority, as strong as the first one, was to facilitate flow and management and schedules. Of course, scheduling is a big problem in healthcare, and solving this is, of course, one of the priorities that physicians expect of AI. The third priority is transforming the way pathway of care and protocols are organized. This is another priority similar to scheduling, which is a pain in the healthcare sector. Reduce the low added value tasks. Of course, this was one of the main priorities that we put forward as a group in AI for Health, and it is confirmed as one of the main priorities also in the Barometer for General Practice, as low added value tasks are the ones that are driving physician burnout and healthcare practitioner burnout. Of course, we need to tackle this with appropriate digital solutions. Less interest in the allow of increased level of specialization of doctors, transforming nursing profession by developing the core expected skills, and encourage more cooperation between doctors. So how to use these results to improve the AI adoption in general practice? A parallel study that we will not be presenting today, but we'll more on that soon, studied how general practitioners are adapting the applications that are available in the mobile health pyramid. We found that the adoption is extremely low in contrast to the high interest that general practitioners bring to artificial intelligence. But more on that soon. How can we first use the results of the AI barometer to improve adoption in general practice? So as we both probably know, we have a national convergence AI plan to improve the adoption of AI in Belgium. But this plan needs to be adapted through a specific track for general practice. General practitioners do not evolve in the same environment as other specialist doctors. And so we need to, of course, provide specific plans for improving performance for the isolated or even in group general practitioner that has to rely more on themselves instead of others. So analysis, diagnosis, identifying treatment, and reducing error are strong priorities to tackle. The second objective is to offer a personalized health to citizens through various ways, such as remote monitoring, smart platforms. Of course, to do that, we need to leverage on the power of data. And I'm really glad that the event right after this one will be chaired by Dr. Thibault Elput, who will explain how we are unlocking Belgian health data. So, and the third objective should be the improvement of quality of life at work for healthcare professionals. Of course, general practitioners, we rely on them for the very first line of care in this country, and we need to improve the way that we care for them through digital solutions that can free up time for added value tasks. So one of the uncertainties about the risks and about the what is expected as a risk from AI is removed when we educate practitioners. This is why education is so important in this country on AI and health. And this is why, with the chair of AI and digital medicine and other educational opportunities, we have brought educational modules for general practitioners. And yeah, just as a side note, the educational opportunities came after the 2 barometers, hoping we will reevaluate the situation in a couple of years and see how educational opportunities have impacted the adoption of AI in Belgium. A last point, we need to improve the clinical validation of artificial intelligence apps, and we need to keep a national register of validated clinical apps with AI software. This is increasingly important, and once again, I cannot stress enough how the sad news of a person committed suicide after using a therapeutic chatbot has had on us medical doctors and AI practitioners both, that we need to tackle with clinical validation. But at the same time, how many times has an AI app helped a patient? This is, of course, another strong argument, but we do not know. And as we do not know this, we need to find out. And it is our duty as scientists and medical doctors, but also policymakers, to carry out such validation studies. The second part is to create an ongoing education about validated apps. So once apps will be validated and once apps will be available, there should be specific education models for such arguments. And of course, the third point is to improve reimbursement strategy. As of now, the reimbursement strategy we have in Belgium is largely insufficient compared to other European countries. So, in conclusion, there is a long road ahead that is awaiting us, medical doctors and AI enthusiasts, into implementing artificial intelligence in general practice. We need both the academic support, policymakers, healthcare organizations, medical doctors, and citizens to improve the way we develop, validate, and use and adopt artificial intelligence apps in clinical practice. And of course, the road ahead is long, but we stay motivated and we make it so that Belgium should be a country in which general practitioners use artificial intelligence to improve the health of patients. So yes, once again, find the complete results of this barometer in the next edition of Numeric Care, who will be online available to people. And yes, if there are other questions in the room, I will address them in a separate way.